It was almost 2 years ago today that many of us gathered together in the Emergency Operations Center downstairs, a couple floors from where we are standing now, to announce the state's first case of COVID-19. We've since announced an additional 915,000 plus cases. We've conducted more than 9.1 million tests. We've administered more than 4.9 million doses of COVID-19 vaccines. And tragically, we have lost more than 4,300 of our fellow Utahn residents. These are friends, neighbors, and family members. Many still deal with the effects of long COVID. We've closed schools and safely reopened them, one of the first in the country to do so. We've masked up and socially distanced. We've stockpiled hand sanitizer and Clorox wipes and toilet paper. We've quarantined and isolated. We've worked from home. We've Zoomed and DoorDashed. There's almost nothing in our daily lives that hasn't experienced at least some sort of change over the past 2 years. But we've also come a long way. And today we are in a much different place than we were 2 years ago, a much better place. We have tools today that we did not have 2 years ago. We have ample testing. We have vaccines. In fact, we have tools today that we didn't have 2 months ago, including widespread home tests and antiviral pills. And it's time for our state's response to the pandemic to make the appropriate shift to better match where we are today. It's time to adapt. All of the key metrics are moving in the right direction. Vaccines are widely available. Uptake continues, and hopefully soon, everyone older than 6 months will be eligible to receive the vaccine. Treatments are more widely available, and supplies are improving every week. Testing is available now in the comfort of your own home. Hospitals and ICUs and the healthcare workers who staff them are still at high levels as they trail behind other indicators, but they too are finally seeing significant relief as we've reduced hospitalizations by more than 200 just over the past couple weeks. It is now time to transition out of an emergency posture and into a manageable risk model. By March 31st, our response will transition to what we are calling a steady state. Our Department of Health will spend the next 6 weeks refining plans they've already started to develop to help us get there. Our response will look different, and that's okay. It's a good thing. Some elements of the response, like testing and treatment, will transition to being the responsibility of our highly capable healthcare systems. This will allow our public health system to refocus on the elements of the response that a public health system would normally look after: disease surveillance, data collection and reporting, vaccinations, and public awareness. Now, let me be clear that this is not the end of COVID, but it is the end, or rather the beginning, of treating COVID as we do other seasonal respiratory viruses. As the state, we are not packing up and heading home. We will continue to see cases and outbreaks and hospitalizations and, unfortunately, deaths. But it does mean that we are adapting how we respond to these things. There is still work to be done. How we accomplish that work is going to look different. And as we have noted many times, the tools don't work if they are not used. So until more people get vaccinated and boosted, we will continue to be ready to adjust and respond. As we move into a more personal risk model, I think it's important to note that we as human beings will all have to decide what that risk variance is for us. There are a whole bunch of people who are unvaccinated and unboosted and at high risk who should take this disease much more seriously. There are also a whole bunch of people in our state who are vaccinated and boosted and young and at low risk who could stand to take this disease a lot less seriously.